drug abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, folks. Welcome to Doctor on Call. Of course, every Tuesday at that time, we have our Doctor on Call program. And we told you 2 weeks ago that this week, the week of the 21st, we will be doing, looking at the area of sickle cells. And also, we will talk about the work of the Sickle Cell Association and what is happening with them. So of course, we have with us none other than Dr. Sonia Nixon. Doc, welcome back. I gave you, was it 1 week off? I gave you or 2?
But you can only give people who work in time off, okay? Only people who get time.
You're working with me.
I'm going to cut it.
I should find if you have your vaccine, before I put you back on the job.
In my house, and I don't need a mask in this environment, but where I in the public, I would be wearing a mask.
Oh, definitely.
I'm going to do the same, even if you have had your 2 vaccines, until we have reached that point where we consider that we may have herd immunity.
Yes, indeed. So, how have you been doing?
And we're doing the love thy neighbor thing.
Oh, yeah. So, yes, indeed. How have you been doing?
Well, I like rain, so.
We've been getting quite a bit.
But we complain about the rain when no rain fall outside dry and rain fall outside wet. No rain, no food.
Well, of course, definitely. So, Doc, this week we're talking about sickle cells, and let me welcome our viewers on GBN Television 7 and 11, our viewers on our Facebook page, and also our viewers on our YouTube channel, and of course our dear listeners on K105 FM. We welcome you to Doctor on Call. We're talking sickle cells. Doc, it's the Sickle Cell Association has been doing a lot of work, and I want to get to that because I want to hear all about it, and it's also important, especially for sicklers, probably who do not know that there's an association, that it does exist, and they can get some form of support, from the association. But first, let's just briefly talk about sickle cell. When you hear someone has sickle cell or someone is a sickler, what do we mean by that?
So we could mean a multiplicity of things. Often what we're concerned about is the people who have what we call full-blown sickle cell disease or sickle cell anemia. Sickle cell disease is a disease of your red blood cells and the heme component of red blood cells, that which carries the oxygen around to your tissue. Oxygen that is so very necessary to ensure that your brain can work and your muscles can contract and you can talk and you can be alert and you have energy to breathe and all of that. So the red blood cells, the heme component of the red blood cells actually carries oxygen around the body. And I'm going to use my favorite, comparison. So the sickle cell, your red blood cells look like a circle, almost like a donut. You know those things that the kids spin? Look at like a donut. The middle is a little more compressed, so it's not flat. Mm-hmm. It has that pressure in it. So the red cells looks like that. And the red blood cells, like I said, it has a hemoglobin complex that helps to carry around the oxygen to your body. The red blood cells needs to be very, very, very flexible, very pliable. Remember we were talking about that, talked about how the cell needed to be pliable, like the guys who are making pizza. Remember? And they can fold and they can go into all these little spaces, especially when it comes to very, very, very small spaces where the blood vessels kind of don't even have walls anymore. They have just what you call sinusoids, which are basically separated by one cell and the other, two of your cells, which are very, very small components of your body. Now, everywhere needs to get oxygen. The bottom line is that everywhere needs oxygen. The cell, your normal red blood cell, is very pliable. Again, like that pizza dough that the guy makes on TV that he's spinning all kind of direction is really soft and stuff. In the case of the people with sickle cell, because they have a genetic abnormality, it causes some changes in the location of one protein, or like an exchange of proteins on the DNA coil. And so the cells, two things happen to them. They become very rigid. They become very rigid, right? They're hard, so they can't move as they should through the blood vessels and through the cells, and between the cells. Two, they're not as flexible. Mm-hmm. Three, they tend to stick together. So they can stick together and cause you to get clots. So that's one of the complications you can have. So basically, the other thing is that, and even as important and probably more importantly, is that they break down more regularly. The red blood cells should live between 90 and 120 days. In the case of people, especially people with full-blown sickle cell disease, your red cell breaks down every 3 months. So that's why if you look at somebody with sickle cell, you might see that they have this yellowing, this jaundice look, which comes from the hemoglobin as it metabolizes in the body. Okay, so sickle cell children have less potential for thriving because the cells are breaking down. The red blood cells are breaking so often, the body tries to compensate, so they have long bones. You can know them, they have these long, very thin bones because the blood is generated, is made, right, in the bone marrow. Right? So this bone marrow becomes very overactive, and so the bones grow a little longer, so they look long and lanky. Mm-hmm. Yet, nutritionally on the surface, they don't look very healthy, right? This is something, however, that you're born with. It's not something you acquire, it's in your genes. If you have sickle cell, you have it and you can't wash it out. Okay. You can't have surgery and remove it. We get half our genes from our mother and the other half from our father. If our mother carries the genes, or she has, well, God forbid that she should have sickle cell, or your father, you almost all, if one of your parents has the disease, you're likely to at least have a trait of the disease. Okay. If both your parents have the disease, God forbid, God really forbid, there's no way that you can miss. All their children will have the full-blown disease. If one has the disease, if two of them have just the trait, you only have a 25% chance of developing full-blown disease. I wish we had a graphic to show people how it happens. But you get it from your parents, you get it from their parents, you get it from their parents, and it moves down the track. Mm-hmm. All right? Significantly, sickle cell disease research only began in the last century. So if you may have seen on the internet, there's a gravestone up in St. Patrick's Cemetery of a young man named Walter Clement Noel, who was the very first subject of sickle cell research in the world, patient zero. Not because he's the first person with sickle cell, but he's the first person to have been recognized as having some abnormal disease that turned out to be sickle cell disease. Mm-hmm. So this is a young man from the Noel family up in northern Grenada, he's going to Chicago to study dentistry. He's in his 20s. And he gets very sick on the ship up to Boston because he goes up to Boston by ship from here and then takes a train or something to go to Chicago. By the time he gets to Boston, he's sick and tired, and he starts having an ulcer on his leg and all the rest. I guess I think is some nutritional challenge because of the days on the ship and you don't get the same kind of food. However, by feeding and stuff, he gets a little better. Who knows what he got? I don't have any real history of what it was. However, he recuperates, the ulcer heals up because it's not significant. But by the time he gets to school, he's just regularly sick. He does graduate from dental school and comes back. However, while he's in dental school, as happened a lot then, because we didn't have the kind of research facilities we have now, sometimes people will always be looking at what your blood looked like under a microscope. And this one young, curious doctor decided he's going to get a blood sample from Mr. Walter and puts it on a microscope and sees these abnormal red blood cells. And hence, the discovery of sickle cell and the research begins. So we do have patient zero, and I think it's important. This is a major heritage to have, albeit for a disease, but that we should all know. Every Grenadian should know sickle cell like the back of their hand, because it's something that we open the eyes of the world to by our... Mr. Noel came back as a dentist and worked for a few years and died at 32. I was looking at the family gravestone today. There was a picture, and looking at the family gravestone, and there were other young people who died. He was 32. And other young people who died. And maybe if he had full-blown disease, it is quite likely that the other people in his family who may at least have had a trait of sickle cell. Okay? So that's our heritage. We know that you're born. Now in Grenada, we're able to screen for the disease. So at birth, you get a little pinprick on your heel, and they send it to the lab, or they use whatever mechanism they do. There is a project in the world, and specifically in the Caribbean, we're looking at, and we screen our children. So if you're born and you have full-blown sickle cell disease, you know from early, right, that you have the potential for that. It is important that we know, because you can actually control how ill a person can become if you know that they have this disease in particular. Sickle cell happens in 1 in every 15 persons. So if you go into around Grenada and start checking ourselves, you'll be surprised. During pregnancy, women are screened for sickle cell. If you're positive, your partner will be screened. Okay? If you're negative, quite likely not. But at least now we're screening all babies. But there's so many people in the country today who have not been screened for sickle cell, who don't know that they even carry. And it's only fair that if my partner, I'm a female, in the case of females, if my partner has a disease, a sickle cell, even the trait, because if he had full-blown disease, because he gets sick, right? Even the trait, it would be good to know what my children's chances are. Do you understand? Right. So, people are encouraged, go get screened, go to the Sickle Cell Association, we talk about, is willing and would really like for people to be screened. If you've heard that your cousin or your sister or your auntie or somebody has sickle cell, there's nothing wrong, especially our young men. We need to know what you're at. Unfortunately, in Grenada, we don't do premarital counseling, which includes medical counseling, right? So you can figure out whether there are diseases that are transmissible, whether diseases that can be shared, can be passed on to your children by means of genes, whatever it is, whether it's mental illness. So spouses know what they're up against, and they can subsequently be prepared to confront it instead of it causing challenges in their marriages or in their relationships. But sickle cell is one of the things that we can screen for easily and know.
Okay, the episodes of pain that comes with having this disease, what brings on the pain? What sort of period are we looking at? In other words, how long can an episode or a crisis last? And the danger.
Maybe anemia, because we talk about sickle cell anemia. It's a form, and anemia means low hemoglobin. Okay, that's what anemia is. Your hemoglobin is low, and like I said, hemoglobin has the responsibility of carrying oxygen around. And there are lots of reasons why we have anemia. Sickle cell is one of those that we identify simply because we have to do things all the time to ensure that it stays up. And sometimes it doesn't really go up very much. Because remember, if your red cells keeps breaking so quickly, right, so frequently, you probably can't. You have to regenerate. So you have to have the nutrition, and you don't really give iron because it causes complications and all the rest of it. But the anemia is probably the most significant stuff. So you have children who are tired. who sleep in class, who don't have the will, they're weak, etc., right? Because the blood count, the hemoglobin count is very low, right? Your HB, which is what we call it, is low, right? So if you see children with a low HB, that's probably the first thing you should consider. Does this child have sickle cell? And also because sickle cell is a disease of people who look like us.
Right.
Okay? It's more prevalent in people of Black origin, African origin. Yeah, there may be somebody who doesn't look Black but has sickle cell simply because they probably have some Black family somewhere. Right? But sickle cell is a disease, it's very prevalent. And like I say, 1 in 15 person would carry around at least the trait when you check us. That is what a rate is like worldwide, and we've seen similar in our children in home school. All right. You remember I told you that the cells stick together?
Yes.
And you remember I told you that the cells lose their plasticity, their elasticity.
Yes.
So, you know when you go out and run, sometimes you go and take a little jog. I know, well, you hear that when people go and run, sometimes they get tired and their muscles hurt and stuff. Because I'm running and jogging, okay? But seriously, so what happens is that when you have a lack of oxygen to the tissue, that's what you have, a lack of oxygen. When you have a lack of oxygen, you will get. And these cells sickle. They look like a sickle. You know a sickle that they used to call?
Yes.
That's why they call it sickle, because it actually looks like a hook.
Yeah, it's good. Right? Yes.
Like a half moon, right? Unlike it's supposed to be round, flat with a depressed middle. Now, these cells tend to clump together, and when they clump together, they block the arteries that is supposed to be going through, and so there's a lack of oxygen in the tissue beyond that, and that's what causes the pain. What is the worst pain we can get? What is the worst form? Well, you get pain in your chest, you get pain in your joints a lot. The kids get a lot of joint pains, and even people who go into adulthood, they'll have joint pains mostly. But there are other things, like you can have severe chest pain, which is a very frightening, a very concerning, because what happens, it means that you have these big, you can have clots in your lungs that prevent circulation. You can have, because you don't have circulation into the small tissues for a long time, you can have damage to the lung tissue. They call sequestration, because these red blood cells get in there and clump up on each other and they can't get beyond that. You can have them they can go into your liver, they can go into your bowels, they can go into your brain and cause strokes, right? So those are the things we're worried about. Not so much just the pain, but the fact that the pain indicates that there's something's wrong. Some clumping of the cells, and that is what we kind of we're very worried about. The children, it's also important that if you're having pain, what do? Take fluid, and sometimes it's children, they don't want to play, or you go to the beach where you get dehydrated, right? And so we ask you, don't get dehydrated, because once you get dehydrated, you're going to be in trouble. Okay? Dehydrated means that your blood volume decreases. If your blood volume decreases, the cells have greater chance of sticking together. They like to stick. All right? So those are some of the challenges that we have with people who have sex.
Right. What about swelling of the hands and feet?
And that is basically caused by the same kind of mechanism.
Right.
Right. And you get joint pains and lots of inflammation and stuff. More than that, what happens beyond that, especially in the feet, is that you have the small arteries clogging, poor circulation, and people who have sickle cell develop ulcers.
Right. Okay.
Because the skin breaks down because you don't have enough oxygen. The tissue dies beyond wherever the clot is, because oxygen is not going there. The tissue will die, and you can have a sore being formed there. That takes a little time, and sometimes these persons who have sickle cell, who have these ulcers, actually need skin grafts in order to, because the skin does not really recuperate itself. So, you really need to have skin grafts in order for them to be able to control it. I'll tell you a story. I always have a story, right? So I'm seeing this lady who's a retired teacher in her late 60s. And she came for something else. And she said, oh, by the way, I'm examining and say, what's happening? She says, oh, I should have told you this. Every so often, a little sore comes there. I said, do you have sickle cell? She said, no, she don't know. She hasn't had any children, right? She has adopted children. And she's 66 years old. And I sent her for a sickle cell test and she had sickle cell trait. Never knew.
Wow.
Because I guess she's probably one of those persons who always drank a lot of water. She was quite active. She comes from the country. She's, her husband was a farmer, so she ate a lot of fresh green food, where she got all the folic acid and all the stuff that was necessary to help her to build back her iron. Right? But she actually had sickle cell trait. Had she had a disease, she should have known.
Right.
She would have known. It will have been a little more malignant, because really the people with sickle cell disease are the one who get like the sequestration episodes, especially with the chest syndrome, acute chest syndrome, which is a medical emergency and for which the person must be admitted to a hospital setting.
Right. Can the sickle cell cause vision problems? Can it affect your vision as well?
Yes, it can, because remember, these clumps can clog any artery.
Mm-hmm.
So you can have challenges to your retina, the back part of your eye, and that will cause you to have problems with bleeding, with vision. And of course, again, they have a lot of they'll have infections, right? Because the spleen is kind of overused. Right, because you have so many cells that are breaking. Your spleen is that like an organ on your left side of your abdomen, up under your stomach, mm-hmm. that breaks down cells. But it gets overactive, and eventually it gets enlarged. And some people actually have to have the spleen removed because it becomes such a challenge for them. But with a spleen that doesn't work well, you would have also a lot of infections. Especially, and even more, you always have to be aware that you can have infections if you have had any challenges with your spleen. Right.
Let me just throw one more question before we go to a break, and then after that, I want to talk with you about the association. Someone with sickle cell, going through some little episodes. When should they see a doctor?
A lot of people who have sickle cell disease kind of know when they're reaching their threshold. So they know, like, I should be drinking my water often, right? I should be doing a little exercise. I should eat healthily, a lot of greens and stuff. They're not to take iron because it causes challenges in the metabolism. So you should know if you have a fever, you're having a cough and stuff. If your jaundice is increasing, you should know time for me to go see the doctor. Mm-hmm. Okay? So currently there are clinics. There's a clinic in the hospital here for children and one in St. Andrew. It may be at, I think it's at Granborough Clinic, where the children with sickle cell go every so often. But remember, like I said, the majority of us don't really attend a regular clinic, right? Because we have a trait, or we don't even know that we have a trait. But if you start feeling sick and you have sickle cell and your joints start to hurt and it's not going away with the usual pain medication, you should really go and see a doctor.
Okay, all right. Let's take our break. When we come back, we'll talk about the association, and then we'll invite our listeners to call with questions and so. Stay with us, folks. We'll be back with you in just a moment.
We support you at every stage of your life.
For business,
for your education,
for your financial freedom,
for that new ride.
Upgrade your life with the Communal. Contact us today.
Valley Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sonatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Clarisil. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
Get vaxxed, hey, hey, vaccinated. Get vaxxed, hey, hey, get vaccinated. Vaccinated. So wear your mask, wash your hands, and practice social distance. This is we chance to advance. Come let we fight this COVID at once. So come on let we fall in line. We want to come back to we social life. There is vaccination island wide. So come on let we fight it to protect we and we family.
This is a message from the Grenada Red Cross and the Ministry of Health.
Level of convenience and comfort awaits you when you shop at Rise and Shine Supermarket and Hardware Supplies, Griffin Lane, Grenville. Convenient, because we are open from 7 a.m. to 10 p.m. Sunday to Sunday. We're even at your service on public holidays. Comfort, because we are easily accessible to the physically challenged. Free Wi-Fi is available while you shop, and bags come at no charge. Everyday low prices and excellent customer care. Adequate parking available. We supply everything you can possibly think of. Family and home supplies, fresh meat, vegetables, and personal care products. All brands of cooking gas at affordable prices. Plumbing fixtures, cutting and grinding discs, PVC glue, drywall screws, and power saw blades. You can send in your order, have it pulled, or pick up express.
We shall fight them on the beaches. We shall defend our islands and our oceans to rid our waterways of plastic and other marine litter. We shall fight in the mountains, the valleys, on the coastline. We shall never surrender until every home on every street in our cities, towns, and villages in the OACS learn to reuse, reduce, and recycle plastic and prevent the pollution of our beloved ocean. We shall fight marine litter together with our sports clubs, our churches, the private sector, our schools. Join the fight. We shall never surrender.
This message is brought to you by the OACS Commission with funding from the Government of Norway. Remlit, tackling ocean pollution from tooth to surf.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Welcome back, it's Dr. Nicole, and this evening we're looking at the issue of sickle cells. Doc, the Sickle Cell Association let's talk about the association and the work they're doing. So give us a little history when it was formed, and all of that.
I'm not sure today, but the Sickle Cell Association is at least a decade old. Formed basically, volunteers as per usual. Some people have families, some people are persons with disease, but all to support the people with sickle cell disease in the community, sickle cell anemia, specifically people with anemia. Get the, if you have sickle cell, we've screened to figure out who has a trait, who has any sickle cells in their body, right? But we provide support for families. We provide support for kids. The volunteers from the clinic, 2 of our nurses, retired nurses, actually run the sickle cell clinics, take care of the kids. So there's they're the communication center. Those nurses are, they do yeoman's jobs. They really take the care. There's a monthly clinic in St. George's, and it's for children currently, and for adult, and one in Granby, like I tell you. What we've seen is a decrease in what we call recidivism, people getting back sick and go back into hospital. They do a lot of education with families. They have a camp for children in the holidays who have sickle cell disease. They assist persons who are unable in ensuring that they get a vaccine, the pneumococcal vaccine for pneumonia, which can be deathly. And we'll talk a while about the complications, because I think people say, "Oh, just sickle cell, I get pain, so what?" But it's a little more than that. Okay, a lot more than that. So they have to get a prophylaxis, a preventative vaccine every year to avoid getting pneumonia. And there's special medication that they take that is available. It's relatively affordable. It's available in our health centers that they take regularly to prevent, and it helps mostly to maintain the stability of the red cells. So one, they don't stick together, but more so they don't break down. So you don't have that regular breaking down, that often breaking down. Because the breaking down is one thing on its own, the sickling is another thing, right? And the sticking together and clogging the heart is even another thing. So you have stability of the cells. You may not have new cells and cells that are very pliable, but you will have less breakdown. So anemia is less. Remember I told you that if you have regular breakdown, you kind of stress out the spleen, and you get things like kidney stones, and you get things like gallstones. Okay, so you find young children having gallstones because the bilirubin, that yellow pigmentation that you see, that causes you to have jaundice, right? Helps to form a special kind of stone in the gallbladder, and that creates a lot of digestive problem, and it's very painful. And we see older people who have gallstones for different reasons, or kidney stones. They are very, very, very painful experiences. And your gallstone will bother you every time you eat something that has fat in it, because your gallbladder produces bile salts that digest fats, right? Every time you eat salts, every time you eat fat, you need to spew out a little to give a little into the gastric tract, and your brain knows this, that there's fat on board. Guess what? Because you have these stones blocking, they will block the bile duct and really cause pain, and the gallbladder is just trying to do its work and contracting, and there's a lot of pain. And imagine a child with gallstones, or a young person with gallstones. So we meet and we try to raise funds. We try to more or less offer support to people who have disease. Where do we centered at the Connection? The Connection is that building where Gleen's Garage is on Kirani James Boulevard. That's where the Sickle Cell Association has its meeting point. Because the headquarters is not that big, but that's where we meet. And we ask, if you have challenges, come in. If people want to know, we have a Facebook page, and there's often lots of information placed, and we answer questions. If people want to ask questions, they can ask on our Facebook page. So Sickle Cell Association of Grenada, and you go on and get information that's there. Recently, we are looking at issues with front of package labeling, because we also have to make sure that our people are healthy, that they're eating properly, that they don't, apart from having sickle cell, you don't need to have hypertension and diabetes. So there's that side.
Right. Now, sickle cell disease can cause a number of complications. What are some of these complications? And after that, I want us to talk a little bit about living with people who have the sickle cell disease. So let's go through some of the complications that are possible for a sickler.
So we basically spoken about why the complications come about, and they come about because 1, these cells break down fast. 2, these cells produce all this bilirubin. 3, these when it's breakdown, you have anemia, and these cells come together and clog up arteries. The worst thing that can happen is in your brain, that your little arteries in your brain happen. So you have young people with strokes.
Right.
Stroke is basically having a deficit of oxygenation into an area of your brain, whether it is because you have a bleeding in there or whether you have a clot, okay? A thrombus, something that goes in and stop the artery. Like when rainfall and you have your pipes in the house, you find that the water pressure goes down, you open the pipe head and you see, there are all these stones in there. In like fashion, it clogs. Right? So the circulation to the area is compromised. So the stroke is, and you can have young children who have had strokes, and that is usually often not something that can reverse, because these like clumps of cells form a thrombus, something that moves from one place to the other until it can't move anymore, stops the circulation in the brain, and you get a stroke. Right? So that's probably the worst thing you can get. You see drooping of the face, twisting of the mouth, difficulty to talk, weakness on one side, and the person may even become unconscious. All right? And we spoke again about the acute chest syndrome, which is a frightful thing, because I've seen kids with acute chest syndrome, significant pain and blood, because these little clots, these little blood clots, they block the lungs, right? And you have severe threat to respiration. And some people, on top of all that, will have a pneumonia, an infection of the lung, because you have compromised circulation, and it creates intense chest pain. So people with sickle cell disease know, or full-blown sickle cell disease, sickle cell anemia, know that once I'm having a chest pain, I need to head to the doctor. I need to head to the hospital. Okay? Or if I'm having unrelenting pain in my joints. All right? Organ damage. We spoke about a lot of the big organs. Remember I told you your spleen can start working badly.
Right.
Your kidneys can also have challenges. We spoke about the liver having challenges. And sometimes those two, the liver and the spleen, with all these clots, they're very important organs, and it can be fatal if you have those organs affected. You asked about blindness earlier, and like I said, with those very, very tiny vessels at your back, at greater risk of getting, the small, even a tiny little, a couple of cells clogging together can probably limit the circulation into those arteries in the back of your eyes and cause things. Leg ulcers, we spoke about that again as a result of insufficient. And one of the other things, the thing about leg ulcers is that it also causes challenges with sense of self. For us, it's not a leg ulcer, it's a sore foot, right? And children get scorned, they get isolated, they get bullied and all the rest of it, right? And sometimes there's damage to bone as far as that, okay? So we have to ensure that these things don't happen. Today we see less of that because, like I said, we've been using medication that actually prevents the severe clumping. Okay. And right? Gallstones we spoke about in the bladder, in the gallbladder, right? priapism. And priapism is where you get an erection, a male gets an erection that doesn't go down. Again, it takes blood for a man to have an erection, you have to have a rush of blood into the penis, right? Mm-hmm. And then there are valves that kind of lock the blood based on the mental stimulation, blah, blah, blah. Okay? But sometimes what you have blood in there, you have an erection, but then clots form in these arteries and you can't get it down. And that can be a severe challenge. You can have you'll have to have surgery.
Oh boy. Mm.
Okay, if you have a priapism, an erection that doesn't go down after so. Right. And then of course we spoke about this a couple months ago about pregnancy complications, right? Mm-hmm. It increases the risk of high blood pressure and blood clots during pregnancy. Because pregnancy on its own, pregnancy in ordinary people who don't have, pregnancy in women who don't have sickle cell, there's an increased volume of blood. Remember, you have this person inside you, or these persons. Yes. Mm-hmm. 1 to 10, because I saw a lady gave birth to 10 children recently, right? Remember, you have this person with a lot of demands, and you have to get a lot of oxygen, a lot of food to them, right? So your body actually, it gets into this increased state of cellularity. There's so many more cells that are in your body just for the function. But if you have a state that creates enhanced clotting, coagulability, that has greater risk of developing clots, okay? Mm-hmm. With more cells you have, more. Also, if you have anemia, you may not be able to have a significant pregnancy. You may lose a baby, God forbid, or you may have challenges with in the growth of the baby within the uterus. So, you can have a miscarriage, you can have a premature delivery, and of course, like I said, a low weight baby because of decreased intrauterine growth.
Right.
And you see, we've been talked about women with sickle cell being advised it is better not, because you really need super specialized environment to have to transition through a safe pregnancy and delivery because of the potential for clots.
Right. Someone with sickle cell, and we, all these complications, that can cause the cluttering or clustering of those cells, stroke, all of that, pulmonary hypertension. In addition to that, people who don't eat healthy, or maybe someone with hypertension, makes it even worse. What kind of diet should a sickler be on? Should they have a specialized diet, or pay very close attention to what they consume?
They require a lot of folic acid, because if they have cells that are breaking down quickly, you need folic acid to build back up the heme complex, okay? That the hemoglobin. So you need folic acid. That's what they all have to take. They all take folic acid and eat a lot of green leafy vegetables. Eat nutrition, not necessarily fat and those fast foods. Eat food that's better. You eat natural foods, fruits and vegetables and beans, and have your meat, and have that kind of diet. Okay. Not fast, not drink sodas and eat cookies and fried foods and all the rest of it. You need to have a substantial diet.
Right. Okay. Living with someone with sickle cell, let's say, for example, a woman gets married to a man that's a sickler. He has a disease. Of course, at some point, he may have a crisis, or she may have a crisis. But one of the individual is okay, all right? Just one person has it. In the case of a crisis, what should that other person do to make the sickler as comfortable as possible? What kind of assistance can that person render to ensure that person is comfortable, and probably to help in some way or the other mitigate whatever complications?
That's why it's very important that we know. It's very important that you have knowledge, because knowledge gives you power, okay? And not just the person who has the disease, but the person whom they live, because you are likely to be suffering on much. I remember a young man, when I worked in an emergency room, who would come in, very dedicated wife, very good, decent young couple. And I looked at how much that wife suffered with him. He would come and crawl on the bed because he'd have these frequent stuff. I mean, then we didn't have as much medication and knowledge was even less. Even if he participated there was a research project in the hospital in which I work, and but some people get sicker than others. Mm-hmm. So the first thing is that somebody knows and understands. They can get the compassion and support. Giving fluids, because you go to the beach and you don't drink enough water. You're out in the sun all day. You're working hard. You're playing football, and you want to exercise and do as much of the normal things that people do as possible. Mm-hmm. But you have to replenish.
Right.
Okay? Uh-huh. So very important that you start giving fluids. And give them the medications of pain so they can feel better. But you look out for pain, fever, right? Difficulty breathing, difficulty ambulating, pain in the tummy. So I say, Lord, my belly hurting me. And he said, where's the pain? And I said, touch it. And I jump off the bed. Then I need to be in the hospital. So all of those things people need to know, because if you have, let's say you have this sequestration, this gathering of a lot of cells under the capsule of the liver, for example, right? It stretches the liver capsule and you get pain, okay? Because you can only go so much, right? You get pain. But if you touch me and it's so tender that you can hardly touch, I know that I'm really in a crisis state, okay? One, that there's a whole lot of blood cells that are under that capsule that are maybe having some tissue breakdown, okay? Because there's lack of oxygen, depending on how far it is from the capsule, right? So depending on the intensity. So families have to understand so that they can say, hey, we got to move. And teachers, if you're in doubt, go to the ER, go to your doctor, go to the emergency room, just go to the hospital. And, the doctors in the hospital know who are the people who have sickle cell, They know. Usually they put up a drip, they give them some pain medication. If there's no fever and stuff, they check to make sure they don't have an infection and so if there's no fever, they send them, they can probably go home. Because sometimes the first problem is really just the dehydration. But often our people with sickle cell, need to be in the hospital if they come and they really have general state being taken. You're just really not good. You're not managing well. You can see that you're feeling low.
Right. Okay. What about worst case scenario? Is there any kind of surgery that can be done to, maybe help, in the flow, to ensure that everything is?
No, you just really need to have. Some patients need transfusions if they get, and the doctor. It's not just every transfusion. Okay, you kind of need to know what they need to get. All right. To ensure you can also get into heart failure because the anemia gets so thin and the poor heart trying to pump over time to ensure heart failure is one of the challenges that they can develop, right? So what they do, blood transfusion mostly. Some people get bone marrow transplant. Those are things that are still highly in the bone marrow transplant highly in experimental. We're not sure. You have to find somebody. How long it's going to last for? There have been some procedures that have been successful. I've seen up 2 cases, a young woman in Chicago and somebody somewhere else, where they've done some surgeries that has, stem cell, and one was a bone marrow transplant that helped to control the disease. But remember, your body's still going to produce those kind of cells. But transplant, if the bone marrow if the transplant catches well in the thing and it makes you produce more of the normal cells, you'll probably be less sick.
Okay, wonderful. So, folks, our telephone line is open. The number 435-2041. If you have any questions that you would like to ask, about sickle cell, you can do so. Or if you're a sickler and, maybe you have some experiences that you'd like to share with us, we'll be more than happy to accommodate you. So, the number again, 435-2041. You can give us a call. I have a couple comments here on our Facebook platform. One person says, my sister was a sickler. She was on a vegetarian diet, no alcohol or fast food, no smoking. She was a trained dietitian. Life with her was constant hospital stay on oxygen. Eventually, she was put into artificial, I don't know if it's a coma they want to put there, I'm not sure. There seemed to be some...
An induced coma.
Right. She died on her 31st birthday, a few weeks before her wedding day. Rather unfortunate. That's sad. Right. I actually missed some of the comments. Yeah, they run very fast. But let me see if we have any on our WhatsApp. Right.
So this young lady, I don't know how long ago this happened. We have a drug that has been a significant tool for helping, like I said, to it does reduce the frequency of those crises, those painful crises called hydroxyurea, which they have to take every day. Because what it does is really just prevent the cells from clogging together. Okay?
Right.
So this is the stickability, and there's just less clumping of cells, so there's less painful crises. So it might also reduce the need for blood transfusion because the cells don't break down. The cells don't break down as often, as frequently, so people don't get into that state of anemia. Because remember, if the cells have to break down every 90 to 120 days, and they break down between 20 and 30 days, maybe your body's just not able. Sorry. Maybe your body's just not able to replenish, especially children, and especially people who are poor and don't have the appropriate nutritional support and all the rest of it. And remember, you can't eat.
Right. Someone is asking, what advice would you give someone with sickle cells and don't have a spleen, I guess?
So people who don't have a spleen are at great risk for getting infections. Remember I said, right? So they must take their pneumococcal vaccines, and vaccines that would prevent all the vaccine preventable diseases. And they just really have to be aware that they are at greater risk for infections. So be on top of the game. If you think you're getting a cold, you might have to go to the doctor. You have a urinary tract infection, go to your doctor. Because the challenge with not having a spleen is the possibility of having infections, and more severe infections.
Right. Someone is asking, can someone with a trait develop full-blown sickle cell disease?
You are what you are when you're born. If you have a trait, you would have gotten a gene from one of your parents, and that's it.
Okay, wonderful. Right. Someone is saying this type of counseling should begin at family planning clinics even before the couple decides to have children. Unfortunately, many of our clinics do not focus on this type of community outreach program. But we do have a Sickle Cell Association.
Yes, but like I said, it's not on that. There are other diseases, other diseases that families need to know. Mental health, right? We need to have very integrated premarital counseling, not just going to your priest or your pastor. Some people don't even get counseling for that, for a relationship, much less to include spirituality in their marriage. But these things should be part of it because it will help us to mitigate a lot of the unfortunate experiences that happen in families. All right? And I agree with the person that, all these counseling should happen long before. But, in life, we also have to seek out information because these may not be considered priorities as chronic disease will, as hypertension, diabetes, as ensuring that you have safe pregnancies, as ensuring that you have all the children are born, all our babies are born in a healthy environment, okay? In a healthy, certified environment, whether you're going to be born in a clinic near to your house or whether you're born home and supervised by somebody who is credentialed and certified to do a home delivery, or whether you're born in a hospital that has appropriate hygiene facilities and services just in case that delivery becomes complicated. Hey, childbirth is a normal thing, okay? It is what happens there. How much billion of us in the world? 7?
Yeah, a lot. Okay, we have another comment. Someone says, "Good night. Thank you for thinking of us sicklers." I have lots of questions. Question 1. Does the husband blood type minimize the transfer of the disease to the baby in pregnancy?
No, because no, I remember it's not transferred in pregnancies. It's from fertilization, from egg and sperm meet. Okay, when daddy comes, he gives you half of his chromosomes, and you give the other half. If the sickle cell gene comes out among those, then baby is probably going to have it. So there's no minimization. It's just objective. He either gives it or he doesn't. If he has full-blown disease, he's quite likely to give one of the. He would give one, always, because you have one or the other. Okay. You're always going to have, right, because you have two. And if mother has it, then she may or may not, right, give it. But there's not a whether father gives more or less. It doesn't. That's why I would advise women who are pregnant to have their partners screened if their partners don't know their status. I would advise mothers who have young boys, we know most of our adolescents have not been screened. A lot of our adolescent boys and older adolescents in particular have not been screened. So we encourage our young men to get screened. We've had a couple of screening sessions. We had a couple of screening sessions last year. So it's important that we know what is the status of everybody in relation, and you can always ask the Sickle Cell Association to help you. I can't remember the number, I'm sorry, but you can go online and you'll see the Facebook page, and there's an email that you can send information.
All right. So the same person says they're asking if you can grow out the disease, and there's some reasons here. She says, "I don't like food, I don't eat well, and I went to hospital when I was in Form 3 and stayed 2 months. I also had a blood transfusion. Since I came out, I never had any serious attack from the disease again. I used to have severe pains in joints, blurred vision, shortness of breath, etc. But now I'm 32 and I barely have any attacks again since my hospital visits. Why is that?"
So, I'd love to ask questions. I mean, is she taking hydroxyurea daily? Because that would be one of the things that would limit the symptoms. Also, I think maybe she just also has her whole nutritional behavior is appropriate, She probably exercises enough, she eats properly, and she's always properly hydrated, because those are things you would learn that you should be taught from if you go to hospital. Nurse should actually tell you that you shouldn't get dehydrated.
Okay, wonderful.
So maybe her own lifestyle really enhances her behaviors and her lifestyle, and congratulations to her. I don't think it's growing out. I think it's growing into your disease, knowing it better and taking better control. And she maybe is taking hydroxyurea every day.
Okay, great. So our telephone number 435-2041. So far we've been getting comments on Facebook and on WhatsApp channel. Let's go to a telephone. Doctor and call. Good evening.
Hi, it was me who placed that comment that my sister had sickle cell and she died. This is a very interesting subject because, of course, we from London. My sister was born in London. She was treated at one of the top UK hospitals in England from the day she was born. She had sickle cell, and it was a nightmare for the family. She lived basically on oxygen and always in hospital. Terrible joint pains, but we were able as a family to manage it very well, with a lot of care, love, support, sometimes staying with her at hospital at night, sleeping by the bed, and the doctors was excellent. There's a lot of black kids in England with sickle cell, and she was one of the first child who were born with sickle cell, and they did not know what was wrong. So, of course, they did surgery, and that made it very worse for her. But she managed to live until she was 31 with severe joint pain. So I really know what it's like to have a sickle in your family, and I really know what the pain is like. And it was very, very sad when she died. But her diet helped her a lot. and love and tender care and warmth and, just supporting and being there. That really, really helped patients. And good oxygen, lots of oxygen and lots of medications. She had blood transfusion, but it didn't work for her, But that's all I wanted to share. It's quite an interesting subject, and it's quite a sad one, too, because eventually most of them die. Thank you for listening.
Thank you, caller. Thank you very much indeed.
I think what's most important, I want to thank this lady because she said she had a lot of love and support.
Yes, indeed. Mm-hmm.
People who have incurable and chronic illnesses. And you notice that the 32 seems to be 31.
Yes, that number is coming up. Mm-hmm.
Right. I think as we get to know, Walter Clement Noel died at 32. Mm-hmm. The person before her sister died at 31. Mm-hmm. Somebody says, no, she's saying her sister died at 31. So I think we're a little ahead of that, because there's more medications, there's less better control of infections, families have a better understanding, right? So it should not be a myth. And of course, some people really do are more prone to, even if you put all the people with full-blown sickle cell disease, if you put all of them together, there's some people who are going to have more severe complications and challenges than others. That's where the cookie crumbles, right? But I'm really happy for this lady for stating how much her family, stood by and give that person and give that she had good care and all the rest of it.
Okay, let's go back to the telephone. Dr. and call, good. Well, we lost that one. 435-2041. Caller, you can try back. We do apologize for that. Yes, 435-2041. That's the number you can call. Let's go back again. Dr. and call, good evening.
Yes, I'm Godfrey and your guest. Now, I just want to find out, like a male or female, could they have sickle cell people I'm talking about? Could they have children? And the secondly, now having a problem with my foot is soothing, both foot doesn't be soothing. I don't know what is the cause of that. Could I get some answers to that? Thank you.
No, don't hang up, because I didn't hear the last part of the question.
Oh, both feet, man, is swelling.
So, have you been to your doctor recently?
A couple of years now. About 5 to 7 years, somewhere around there.
Well, you're going to have to do that in the next week. Do you have high blood pressure or diabetes or anything like that?
Yes, high blood pressure.
Yeah, so you kind of need to go see a clinician. If you have high blood pressure, you should be seeing a doctor every 3, maximum 6 months.
Yes, I does, but they never tell me anything concerning that.
Well, ask the doctor, tell him you're concerned, you want to know what else is going on. So the other thing, your question about sickle cell, people with sickle cell can have children. That's why we have people with sickle cell, because their parents before them had sickle cell. It is advisable, however, for women who have full-blown disease not to, like I said earlier on, because it becomes so complicated in pregnancy. Pregnancy on its own has, as I said, women have more red cells, more blood cells. And if you're already prone to having a lot of having clumping of those cells, if you have more cells, you can have challenges. And they really advise, as far as possible, not to have children. If you have, and remember, there's sickle cell trait and there's full-blown sickle cell anemia, which is what we're really looking at, the people who have severe disease, who have the gene from their mother and their father. People with just a gene from your mother or father, yeah, they have children. Just make sure you check the partner that they don't have the gene, because your child has a 25% chance of being born with a full-blown disease if both of you have sickle cell. And a 25% chance of not having sickle cell at all. But there's a 50% chance that a child will have a trait. So that is why we ask that everybody should be checked before they decide to have children. Except that often we don't decide to have children, we just have them.
Okay, wonderful. 435-204, and we go back to a telephone. Doctor and caller, good evening. Hello.
Good evening. Good evening.
Yes, good evening, caller. Go ahead, please.
Right. Excellent program with Doctor this evening. Just wanted to to say, I'm not sure. A lady called before about her sister passing at the age of 31. We're not quite sure what year that happened, but just really to bring us into the present day. Our sicklers live well up into their 70s and 80s with a lot less crises, as was explained by the doctor, providing they have neonatal testing so that their parents know very early the status of their children and that they follow all of the advice given, such as ensuring that they do not get dehydrated at any time, the diets and everything else that will boost the system, and that they keep in close contact with the medical professionals and, of course, the Sickle Cell Association of Grenada. Must say something positive about that association, as Doctor has said, because there is so much work that is going on with the few volunteers, and we're constantly looking for more volunteers to ensure that the work carries on. I mean, we have, Doctor would tell you, a lot of people registered with the association at the moment, and we really want more volunteers. And we want to encourage the families and also to encourage people to know that, you know, they can have a long and a successful life, and a life not so much with so many crises once they follow the advice given by the medical professional and the organizations, all of whom work closely together. I didn't want people to start thinking that they're coming up to their 31st birthday and it will be the end of life for them. That's only about 1/3 of the life they can have. Thank you so much. Thank you.
Thank you very much, caller.
That's a very good point, because...
No, of course it is. I mean, I do know people who are well up, you know, in age, and they are sicklers. Mm-hmm.
No, but there's sicklers and there's sicklers, okay? Remember, we have people who have just a trait, who are going to look at pay and stuff, and there are people who have full-blown disease. But knowledge is power, like I said at the beginning.
Yeah.
If you know what to... And I really wish, I hope the lady who called to tell us about her sister and the other one who told us about herself, it'd be nice if they become members of the association, because we can, the people who suffer with disease presently, you know, there's always stigma related to disease like that, because children with sickle cell miss a lot of school. We try our best not to make that happen, but they often need encouragement that, look, you can do better. Here's how I manage. You know, that kind of support is very important to ensure that people who have the disease will can transition through normal lives.
Right, I have a very interesting comment here. Someone is saying, I think it really boils down to understanding the disease. That I mean how it works. Everything needs to be done in moderation. I used to get into crisis very regular, but I took time to understand how it works. Now I'm 37 and I haven't had a crisis since 2007 or to be admitted or warded at the hospital. I did get pain thereafter, but have never been warded since 2007. So that's excellent.
So I wish this person would become a member of the association, because, you know, you have all these experiences to share. And like I said, we're trying to identify our children at birth, or persons who have sickle cell at birth, and they need this kind of counsel. They need this kind of support. You know, me too. I've been there. I understand, right? And they need to know that they're not alone in all of this.
Right. The person says my HB, and I guess they're talking about the hemoglobin count, used to be like 6. Now it's like 11 something. And then someone else says, where is it? Yes. I didn't know about the association. I will definitely volunteer. I'm happy there's one and they need us. I already liked your Facebook page. So they've already liked the Facebook page and they'll be more than happy to become a volunteer.
Right, the number to contact will be on the Facebook. Just go and ask questions, and, you know, we're willing to and share your experiences. We're willing to know what's going on out there, especially our Facebook page, because it is a place where it's a crossroad. That's what our Facebook page is about. Let's face up to what's there. Let's learn it. Let's learn new things. Ask questions. There are often posts there that are beneficial both to people who have sickle cell and not. Mm-hmm. But truth is, I may not have sickle cell. I don't have sickle cell in my family. No, like I have my cousins their father and my father are brothers, but their mother's side of the family has sickle cell. And incidentally, we have a person with sickle cell disease among our relatives, so even though I don't, I'm very aware that this is a situation that we have here. And at least I can offer support and, be aware that this is something for us as well. So we don't have it, but, our cousin does. So what's happening with him? How are you doing? How are you coping? Right? And he hasn't been ill for a while. He works and lives a normal life, is married and all the rest of it. So. Okay.
Doc, we don't have a lot of time, but one last question I want to ask quickly. A sickler, in terms of, let's say, comorbidity, having other chronic conditions, have you seen cases like that? Let's say a sickler being maybe hypertensive or diabetic and things like that? And when that happens, what are the chances?
I personally don't have a person with full-blown sickle cell disease who has that, but you get managed like you get managed for everything, as you're very aware. Okay, and if I have a person who has sickle cell disease and who have diabetes and hypertension, I'll be very concerned. Make sure that we can manage you very well, because with diabetes and hypertension, you're already at an increased risk for strokes, heart attacks, kidney failure, right? And with diabetes, of course, circulatory challenges. So even more, I'd be even more astute and more finicky, for want of a better word, about how my patient is able to manage his illness. He's going to need as much support, and because that's 3 unrelated related chronic diseases that tend to have similar complications. So therefore, I would really be very stringent with managing my patient. The other thing is that because we have hydroxyurea that given us lifespans to 78, we're going to have more people with chronic disease. As you get older, your risk for chronic diseases increases, right? So we're going to have it. So that is something that people who are healthcare givers are going to have to be aware of, that here comes Mary Jane, who's known to have full-blown sickle cell disease, hypertension, diabetes. We're going to have to make sure that she's fine. It also means that we have to do as far as possible to prevent those diseases by lifestyle, exercising, eat properly, don't eat the garbage that makes all of us get diabetes and obese and all the rest of it, right? So we're going to have to guide our people with sickle cell disease. Not that you're going to live to reach 80, let's try and do that smoothly.
Okay, wonderful.
And other things don't come to play.
And my final question to you, someone with sickle cell, should they get vaccinated for COVID-19?
I would like to pass on that question, but I think it was said yes, because even if sickle cell people are more prone to getting clots. I had a discussion with one of the internists in relation to another patient who had a propensity to develop to having clots. And what I noticed is that the people who had clots as a result of one particular vaccine, which was AstraZeneca, I don't know what Pfizer, but AstraZeneca is what we have been using. The people who actually developed clots never had any known propensity, so they didn't have relatives with clots and stuff. So I'm not going to say yay and nay. I wish we'd speak to the people who are the ones who are developing but you shouldn't. I really don't know personally. I don't want to say yes on that. Okay. That's something I'd have to educate myself on. But like I said, I've been asking about other people who have what we call the coagulopathies, people who have propensity to clotting, and I was told that the people who actually had clots as a result of taking the AstraZeneca vaccine never had any challenges with clotting before. No history.
Okay. All right. Thank you very much. Well, Doc, that's all the time we have for this evening. Again, I want to thank you so very much. I want to thank all the people who commented on our Facebook and on our WhatsApp platform, the calls. It's a pity we are out of time, but definitely the conversation and the discussion and the education continues every Tuesday right here on K105 and GBN TV and our Facebook and YouTube channel as we engage Dr. Nixon, and of course from time to time we'll have other doctors coming in to talk on different areas. So thank you once again, and don't forget to join us next Tuesday for another Doctrine Call. Doc, any final thing in closing?
Yeah, and I really want to thank the lively questions, the questioning questions. I really want to thank the people for their interests, and I hope those of us who listen tonight, just get especially your boys, get them screened so that we don't have surprises when our babies are born. We all need to know status, okay? Remember, the Sickle Cell Association is there to help. We're at the connection, that building up where Glee's Garage is on the upper floor. You can go there. If you go onto our Facebook page, you will definitely see where we are and how to get in touch with us. Like us, and you'll get information. I also, as we still want everyone to remember that there is still coronavirus in the air. I know this weekend we had 3 people who broke our borders and came in from an area that had a very high infection rate of coronavirus and a very, very high death rate, and that is Brazil.
Yes.
We are not, because we think, I know the young people think that they shouldn't. I'm going to ask you. You had vaccines when you were a baby, and you're still alive today. One of the things of the pediatricians in the U.S. have as a slogan for vaccines that vaccines make adults. Let's all give ourselves a chance to live into old age. If you're concerned, just go to where they're giving the vaccines and have a discussion. Don't take the information that's out there, because it's really just confuse you. And I'm really very sorry that this is what's happening. Or young people, you want to go there and have party and all the rest of it, wait until you have your shots. If you have your vaccines, it's going to come back to normal sooner if all of us work together. Notice that we had lockdown very early, and that kind of stayed the spread away. The countries that didn't lock down had severe problems. The US, Brazil, Trinidad who opened. Mm-hmm. Everybody who has had elections, St. Vincent, Suriname, Guyana, Trinidad, Jamaica, those
yes.
had elections, have all had an upsurge in their coronavirus incidents in new cases. And look at Trinidad; they've had 1,000 deaths.
And it happens so quickly. Okay. Yes, indeed.
So let's be honest with ourselves, and let's not be derailed by the information that's meant to confuse us. Go there and read and ask. Don't ask me foolishness about they call it about microchip. Geez, you have a microchip in your hand every day, is it?
Yep.
Okay. Those are things that are meant to distract us, and this is one thing I'm going to ask you to be selfish about preserving your own life. And above all, I'm going to ask you to love your neighbor by preserving their lives, by getting your vaccine, and by doing what is hygienically necessary. Wear your mask over your nose and your mouth, wash your hands, and keep your physical distance until things are good. You don't soon be part.
And the thing is, the more we do it, the quicker we get back to normal.
Yeah. We all gonna get a chance to ramage here again. Trust me on that.
Definitely. Doc, thank you once again, and of course, enjoy the rest of the evening, folks. Don't forget, you can see or you can find Dr. Nixon at the top floor of the Bruce Street Mall in St. George's. All right, so you can visit her. Remember, we can't diagnose on the telephone. You have to go in to see Dr. Nixon. She's at the Bruce Street Mall, downtown St. George's. Thank you very much. Do have a good night. All the best.
Good night.
Drug abuse,